My dear friends, if every morning your knees feel locked the moment you step out of bed, if standing up from a chair feels harder than it used to, or if your knees start to ache and burn even after a short walk, then I want to tell you something very important. This is not old age. It is not your fate, and it is absolutely not something you have to live with forever. A recent 2024 study revealed that over 68% of adults over 60 who experience knee pain are not suffering from aging, but from a loss of strength in the muscles that protect the knee, especially the quadriceps and hip muscles. These are the muscles that allow you to stand up, walk confidently, and keep your balance. And here's what shocked the researchers. Just one simple daily movement, no equipment, no gym, can reduce knee pain, strengthen your legs, and improve independence even more effectively than walking. Today, as a doctor who works with thousands of patients over 60, I want to remind you of this truth. Your body can recover. At 60, 70, or even 80, your strength can wake up again when you train it the right way. And in this video, I'm going to show you the simple but extremely powerful movement backed by research and used with my own patients that can noticeably reduce knee pain in just a few weeks. But before we begin, tell me your age and where you're watching from. I read every comment. We are a community getting stronger together. You know, over the years, I've had so many patients in their 60 seconds, 70 seconds, even 80 seconds walk into my clinic and say the same thing. Doctor, I just want to walk normally again without pain. And some take my hand gently and whisper, I just want to stand up on my own. I don't want to bother my children. Those words may sound simple, but they carry a lifetime of emotion. For younger people, standing up, walking around, or climbing a few steps is effortless. But for many adults over 60, those small actions become a real mental challenge. And I understand that feeling. The feeling when knee pain slows you down, when you have to press hard with your hands just to stand up, when every step requires extra thought because you're afraid of losing balance or falling. But here is the wonderful truth. Your body is not abandoning you. It's simply sending you a message, I need to be activated again. And it's from these stories, these honest wishes from my patients that I became determined to find the simplest, safest, and most effective exercises for people over 60. And in just a moment, I'll show you the exact movement I teach every patient who wants to reduce knee pain and regain their independence. Before we start today's exercise, I'd love to ask you something. How old are you and which state are you watching from? I read every single comment, and it truly makes my day to see our community growing, getting stronger, and becoming healthier together. When we pass the age of 60, the body begins to go through a very quiet change that most people never notice. We lose about 3% to 8% of muscle strength every year, especially in the quadriceps, hips, and glutes, the muscles that keep the knees stable. And here's something many people don't realize. Walking is good, but it does not properly activate these muscles. Walking only uses a small portion of your leg strength, so relying on walking alone to keep your knees healthy is simply not enough. A 2023 study from the Mayo Clinic followed hundreds of adults over 60 and found that just one daily exercise that strengthens the quadriceps reduced knee pain by up to 52% in only 4 weeks. And the results were even better in people who had long-term knee pain. The reason is simple. When the muscles are weak, the joints are forced to do all the work. But when the muscles wake up and get stronger again, the knee becomes unloaded, pressure decreases, and the joint can recover naturally. In other words, knee pain isn't caused by age, it's caused by weakened muscles around the knee. And that is something we can absolutely improve. Right now, I'm going to show you the most important movement to reactivate knee strength. Now, I want you to join me in the most important exercise for reducing knee pain and rebuilding strength. The sit to stand, a gentle, improved version of standing up and sitting down. This is the exercise I give to almost all my patients because it directly strengthens the muscles that protect your knees, especially the quadriceps and the hip muscles. If you usually have to push hard with your hands just to stand up, or if your knees feel stiff, weak, or painful every time you rise, that's a clear sign the muscles around your knees have weakened. When the muscles weaken, the joints are forced to do the work, and that's when pain begins. But here's the good news. Once we reactivate and strengthen these muscles, the pressure on the knee decreases, and the pain gradually fades. Researchers at the University of Copenhagen discovered in 2024 that adults over 60 who performed this exercise 5 days a week increased leg strength by up to 89% in just 8 weeks, and those with long-term knee pain saw an average 53% reduction in pain. These numbers are impressive and even more powerful because I've seen the same results in thousands of my own patients. Now, let's begin. Sit on a chair with your feet hip-width apart. Place your heels firmly on the floor. Lean forward slightly, as if preparing to stand. Then gently push yourself up without using your hands until you're standing tall. Exhale as you rise. Then slowly lower yourself back down, controlling the movement, and inhale as you sit. Don't let your body drop into the chair. Keep the motion steady and smooth. Throughout the exercise, watch your knees. Don't let them collapse inward. Keep them aligned and stable. If you feel light fatigue in your thighs, that is a very good sign. Your muscles are turning back on. But if you feel sharp pain, stabbing pain, or dizziness, please stop immediately. For beginners, I recommend doing 8 to 10 repetitions in the first week. In week 2, increase to 10 to 12 repetitions. Week 3, move to 12 to 15 repetitions. And by week 4, if you want a deeper challenge, you can hold a small weight about 1 to 2 pounds to increase muscle activation. When you practice this exercise daily, or even every other day, within just a few weeks, you'll often notice real changes. Standing up becomes easier, walking feels steadier, less fear of losing balance, lower risk of falls, and most importantly, knee stiffness and morning pain begin to fade. And the best part, your independence, the ability to do simple daily tasks on your own starts coming back. Now, let's move on to the next part. Before we continue, I want to remind you of something very important for your safety. Throughout this exercise, if you feel any sharp pain, stabbing pain, or if your knee feels like it's catching or locking, please stop immediately. That's your body signaling that it needs rest or that your form needs to be adjusted. But if you feel mild muscle fatigue, gentle warmth, or a light stretch in the thighs and hips, that is completely normal. In fact, it's a good sign. It means your muscles are activating. Waking up after being weakened for so long. Always listen to your body. There's no need to rush, and no need to push yourself to do more than you can. The most important thing is consistency, little by little, one step at a time. You're rebuilding the foundational strength that supports your knees, and that requires patience and kindness toward your own body. If you are taking medication or have had knee surgery in the past, please move more slowly and place a sturdy chair behind you for extra support. And as always, safety is our top priority. Let your body lead the way, we're simply guiding it gently. Now, when you're ready, we'll move on to the next part, the part where you'll begin to feel the real difference your body can make after each session. Now, before we close today's session, I'd like you to take a few quiet seconds to listen to your body. Stand still or sit comfortably, and simply notice the movements you just made. You might feel your legs a little warmer, your knees a little lighter, and your breathing a bit steadier than when you first started. These small changes are wonderful signals, signs that your body is responding, growing stronger, and healing day by day. What matters is not how many repetitions you did, or whether every movement was perfect. What matters is this. You began. You took time for yourself. You chose to care for your legs, and your knees, the foundation of independence after 60. Every time you stand up without using your hands. Every time you walk without feeling the same pain. Every time you sense even a little more confidence in your steps. That is success. That is your daily life becoming easier, lighter, more yours. Our bodies at any age have the ability to recover. And today, you proved that. With one simple exercise and a few minutes of patience, your body has already given you hopeful signs of change. Be proud of yourself. Feel this small moment of joy because it is the first step in a much longer journey towards strength, confidence, and the independence we all cherish. And when you're ready, we'll move to the final part, a gentle message and an invitation to continue this journey together in the days ahead. Before we finish today's session, I want to offer you my heartfelt gratitude. Thank you for taking the time to care for yourself. Thank you for your patience, your effort, and your belief that your body can continue to improve every single day. Sessions like this are not just movements. They are gifts you give to your future self, a future with more confidence, more strength, and more independence. And if today's exercise brought you even a little relief, a little hope, or a little motivation to continue tomorrow, then I'm truly honored to be on this journey with you. If you'd like to receive more daily exercises like this gentle, safe, and designed specifically for adults over 60, please consider subscribing to the channel. Not for the numbers, but so we can keep meeting here, keep moving together, and keep getting healthier day by day. Every subscription is a meaningful encouragement to me and a reminder to continue bringing you the most helpful exercises I can. Thank you for spending this time with me today. I wish you a light, energetic, and joyful rest of your day. And I look forward to seeing you in our next session.